Thyroid hormone disorders are critical to recognize as they can significantly impact a person's health and quality of life. Understanding the clinical manifestations and anticipating potential complications is essential for effective management. Let's dive into the details. First, let's talk about hypothyroidism. This condition arises when the thyroid gland doesn't produce enough hormones. Common risk factors include autoimmune diseases, certain medications, and a history of thyroid surgery. Clinically, patients may experience fatigue, weight gain, cold intolerance, and depression. Management typically involves hormone replacement therapy, usually with levothyroxine. As nurses, we must monitor thyroid levels regularly and educate patients about the importance of adherence to their medication regimen. Now shifting gears to hyperthyroidism, where the thyroid is overactive. Graves' disease is the most common cause, an autoimmune disorder that leads to excessive hormone production. Risk factors include family history and female gender. Patients often present with symptoms like weight loss, increased appetite, heat intolerance, and anxiety. Treatment options include anti-thyroid medications, radioactive iodine, or even surgery. Nursing considerations here involve monitoring for signs of complications, such as thyroid storm, a life-threatening condition characterized by fever, tachycardia, and altered mental status. Next, let's discuss Hashimoto's thyroiditis, another autoimmune condition that often leads to hypothyroidism. Here, the immune system attacks the thyroid, causing inflammation and damage. Risk factors include being female and having a family history of autoimmune diseases. Clinical manifestations can be subtle at first, but as the disease progresses, patients may experience the typical symptoms of hypothyroidism. Management focuses on hormone replacement, and it's crucial to educate patients about the chronic nature of this condition. Thyroid storm is a rare but critical emergency that can occur in hyperthyroid patients, especially those with untreated Graves' disease. It can be triggered by stress, infection, or surgery. Symptoms include high fever, rapid heart rate, and confusion. Immediate treatment is vital, often involving beta blockers, anti-thyroid medications, and supportive care. As healthcare providers, we must be vigilant in recognizing these signs early to prevent severe complications. Lastly, myxedema coma represents the extreme end of hypothyroidism. It's a rare but life-threatening condition that can occur in patients with long-standing, untreated hypothyroidism. Risk factors include severe illness, cold exposure, and certain medications. Clinical manifestations include profound lethargy, hypothermia, and respiratory failure. Management requires immediate hospitalization, intravenous thyroid hormone replacement, and supportive care. As nurses, we must be prepared to act quickly, as this condition can be fatal if not treated promptly. To reinforce our understanding, consider these knowledge check questions. What are the key clinical manifestations of hyperthyroidism? How does the management of Hashimoto's thyroiditis differ from that of Graves' disease? And what immediate actions should be taken in the event of a thyroid storm? Recognizing these disorders and their complications is essential for effective patient care. By staying informed and vigilant, we can make a significant difference in our patients' lives.